Sound of the thyroid. Extend the patient's neck. You can place the pillow behind the neck of the patient and ask the patient to look upwards towards the ceiling and place the probe transversely in the center of the neck. So this will be your transverse. Now getting the transverse, you rotate the probe longitudinally and then maneuver it in a way that you can get all of the thyroid. Similarly, on the left side, you will place the probe longitudinally and then angle the probe towards the patient's left to get the thyroid with common carotid artery. Another technique is see the thyroid in total in transverse view. You can get both lobes together and then get hold of one, move the probe towards the right or the left lobe and angle it 90 degrees from there. You place the probe transversely, get all of the maximum of the thyroid you can, and then from here you turn towards, move the probe towards the left or to the right of the patient, and where you get one lobe, here as we are moving towards the left, you will get the left lobe, and now angle it 90 degree to get the longitudinal section of the thyroid. This is the scanning technique of the thyroid. Let's see what we can see in this patient. I place the probe transversely, and this is what I am so far able to get. I am getting both lobes together. Now this is common carotid artery in transverse section. This is the common carotid artery again. This is the left and this is the right. So this is the common carotid artery in transverse section. This is the common carotid artery in transverse section. This is the right lobe of the thyroid, and this is the left lobe of the thyroid. In between this area, this band of tissue is the isthmus, and isthmus in this patient is enlarged. This is the isthmus, this one, this portion. These shadows, black and dirty, are tracheal air shadows. Tracheal air. Tracheal air shadows. These are the tracheal air shadows. So this is the right lobe in transverse section. This is the left lobe in transverse section. So this is the transverse section of the right lobe of the thyroid. This is the transverse section of the left lobe of the thyroid. So we are getting this view in the thyroid in transverse position. Now Let's see what is its measurement. In this dimension, the thyroid measures approximately 3.3 and 3.2 centimeters, which is, and this is the landmark. In fact, this is the landmark for the identification of the thyroid lobe, this common carotid artery in transverse section. You can see that in transverse section there are multiple ill-defined hypoechoic areas scattered throughout the thyroid parenchyma. Its echogenicity is much coarse as compared to that of the normal, and at places it is hypoechoic, at places it is echogenic. This is the normal area, this is the hypoechoic area, this is hypoechoic area. So it has a rather heterogeneous appearance. Now, this is keep the anatomy in your mind so as to move further. Now, in fact, this is the parathyroid gland. Now I am going to scan the patient in a longitudinal. So I am moving the probe towards the right, and now I am going to angle the probe 90 degrees. Here I am, and I can see I got the landmark for the thyroid, which is the common carotid artery. This is the right lobe of the thyroid. It is enlarged